Ilioinguinal block dissection, IIBD, is a surgical procedure used primarily for the management of metastatic groin lymph nodes, commonly in cases of cancers like melanoma, squamous cell carcinoma, or other malignancies. While effective, the procedure is associated with a variety of potential complications due to the complexity of the anatomy and the extent of tissue dissection. Below are the complications, categorized into immediate, early, and late. Immediate complications. 1. Bleeding and hemorrhage. The inguinal region is highly vascularized. Injury to femoral vessels or tributaries can result in significant bleeding, sometimes necessitating blood transfusion or reoperation. 2. Injury to adjacent structures. Femoral vessels. Accidental damage can lead to life-threatening complications. Femoral nerve. Injury may result in weakness or paralysis of the anterior thigh muscles. Obturator nerve or other branches of the lumbar plexus may be inadvertently injured, causing pain or functional deficits. Early complications. 1. Wound-related issues. Hematoma. Accumulation of blood in the wound bed can increase infection risk or delay healing. Seroma. Common due to the extensive lymphatic disruption requiring aspiration or drainage. Infection. The groin area is prone to bacterial colonization due to its proximity to sweat glands and hair follicles. Cellulitis or deep infections may occur. Wound dehiscence. Breakdown of the surgical incision due to tension, poor healing, or infection. 2. Lymphedema. Disruption of lymphatic drainage pathways can lead to swelling of the lower limb on the affected side, potentially affecting mobility and quality of life. 3. Nerve pain or neuropathy. The ilioinguinal, iliohypogastric, or genitofemoral nerves may be irritated or damaged, causing burning, tingling, or numbness in the groin, thigh, or genital region. Post-operative neuralgia is common and can persist for weeks to months. Late complications. 1. Chronic lymphedema, persistent swelling in the leg due to lymphatic disruption, which may increase the risk of recurrent infections like cellulitis or lymphangitis. 2. Chronic pain and numbness. Residual damage to nerves can result in ongoing pain, paresthesia, or numbness, impacting the patient's quality of life. Neuroma formation, nerve regrowth into scar tissue, may exacerbate pain. 3. Vascular complications. Venous thrombosis or deep vein thrombosis, DVT, due to immobility or venous injury. Long-term venous insufficiency leading to leg swelling and varicosities. 4. Delayed wound healing and scarring. Hypertrophic or keloid scarring, which can be uncomfortable and cosmetically displeasing. Sinus tract or fistula formation in cases of deep infections or chronic inflammation. 5. Recurrence of disease. Despite meticulous dissection, there remains a risk of residual or recurrent cancer in the groin region requiring further treatment. 6. Functional impairments. Reduced range of motion or strength in the affected limb, especially if the femoral nerve or muscles are compromised. Difficulty in walking or prolonged standing due to pain or edema. Risk factors for complications. Patient factors. Obesity, diabetes, peripheral vascular disease, or immunosuppression. Extent of disease. Advanced tumor stage or bulky nodal metastases. Surgical factors, prolonged operative time, large surgical field, or lack of meticulous technique. Prevention and management. Preoperative measures. Thorough patient assessment and optimization of comorbidities. Use of preoperative imaging to guide dissection. Intraoperative strategies. Precise surgical technique with care to preserve neurovascular structures. Use of suction drains to prevent seroma formation. Post-operative care. Compression therapy to minimize lymphedema. Early mobilization and physiotherapy to prevent DVT and improve function. Antibiotics to reduce the risk of infections. Regular wound inspections and timely intervention for complications. In conclusion, while ilioinguinal block dissection remains an important tool in oncologic surgery, its high complication rate necessitates careful surgical planning, skilled execution, and close postoperative monitoring to minimize risks and optimize outcomes.